Hey everybody, thanks for attending tonight's webinar. Welcome. My name is Andrea Fragala and I am a licensed independent social worker practicing in South Carolina. I am also a Scarring Alopecia Foundation board member and I am so happy to be here with you guys tonight. Speaking of Scarring Alopecia Foundation, how about the new name? We've gone from CARF, which was a mouthful, to Scarring Alopecia Foundation. So I personally love it. It's much more searchable, easier to pronounce, and according to Jean Pickford, our executive director, so many of SAF's members have echoed that same feeling. So this is the very first webinar in 2022's main event series. So welcome to the very first one, hosted by, we'll say it one more time just for fun, the Scarring Alopecia Foundation. There's going to be 3 other webinars this year. More information will be coming out shortly about that. So you can mark your calendar for Wednesday, May 25th for the next webinar. And that's going to be on the medical review of treatments. So that's going to be a good one. Definitely check that out. Tonight, my colleague Kim Holly and I are going to be each doing a presentation. Kim is going to be presenting on mindfulness-based stress reduction, and I will be doing a chat on practicing self-compassion. At the end of both of our presentations, so once both of us have concluded, there will be an opportunity to field any questions that you may have. There's going to be a chat box underneath the video where you can enter your questions in, and they will pop up for us, and we will do our very best to answer those for you. Also, as a reminder, this webinar is being recorded and will be available for you and those who missed it to watch again. The recorded link will be sent to you within a few days of the end of this presentation. Okay, so with all of that, now I think that's all of the housekeeping items. I would love to introduce my colleague, Kim Holly. She is a licensed marriage and family therapist who I have had the pleasure of working alongside for the past 6 years, who so kindly has offered her time tonight to be here with us. And I'm actually just as excited to watch her presentation as I'm sure you guys are. So Kim, welcome.
Hey, Andrea. Thank you for having me.
Yeah, thanks so much for being here. We really appreciate it and are really looking forward to hearing all about using some mindfulness-based stress reduction. We could all use that. So without further ado, I am going to kick things off with my chat about self-compassion. So I feel like it needs to be said, because I'm sure it's still swimming around in many people's minds, about the Oscars last night. And here I am about to give you guys a bunch of information on why we need to practice self-compassion. And there was someone who was just publicly teased with alopecia. Now, I don't believe that Jada's alopecia is scarring alopecia, so slightly different, but nonetheless, still a disturbing thing, I'm sure, for many of you to witness. And when I was thinking about what needed to be said about that, really what I came up with is this is exactly why we need to practice self-compassion. Because we can't control the actions of others or what's going to happen, or even our interpretation of events that may be completely wrong about someone looking at our scalp or seeing our hair loss. And practicing self-compassion is a way to create some resilience around that. So I feel like this is a very timely presentation. So my heart is with all of those of you who felt offended or it increased embarrassment in some way. Please know that some of what we're going to chat here about tonight is exactly how to deal with some of those emotions. Okay, so practicing self-compassion. Why do we want to do that with scarring alopecia? And this really is for any chronic illness you may be dealing with. I know oftentimes people with scarring alopecia, it's not the only condition that they may be managing. So practicing self-compassion increases our resilience to stress and trauma. We've all just been through a 2-year trauma-filled, stressful time in life. So even if you had nothing else going on in your life except for the pandemic, welcome. We are going to learn to increase our resilience through some self-compassion. It's also, practicing self-compassion is also linked to healthier habits. And it's also linked to increased confidence and motivation, which is super, super important for anyone who has a condition that may be altering their appearance in any way. Okay, so if you have been to a webinar with me before, one of them was solely dedicated to radical acceptance. We're not going to spend a ton of time on that this evening. There is another webinar if you wanted to go back and review it that is all dedicated to radical acceptance. However, we cannot talk about self-compassion without talking about radical acceptance. So a couple of key points here is this is sort of this bitter pill to swallow tonight, that pain is inevitable. We are all going to experience pain in life, whether we want to or not. We don't get a choice. The pain comes in many different shapes and sizes and has a variety of lengths of time that it can last. However, it is inevitable. The part that's optional is suffering. So suffering is what happens when we don't accept life's pain. And this can make it very, very difficult to be skillful and compassionate towards yourself when dealing with any chronic illness. So it's like step one is acceptance of the pain of living with scarring alopecia or any other conditions you may have. This is not an easy task. I want to remind you that acceptance is not condoning. It's not liking it. It's not saying that you wanted it to happen. It's just acceptance of what is. It's the absence of fighting the reality. So we want to practice getting into acceptance around the fact that we are dealing with a scarring alopecia. This does take a lot of practice, and I highly recommend that you watch the full presentation on radical acceptance. And if you're finding yourself really, really stuck, please, please, please seek some additional support, whether it's in some of the Scarring Alopecia online support groups, through the Scarring Alopecia Foundation. There's also Facebook pages. I've known some people to get together in person. And of course, if you are really struggling, there is nothing like, obviously, an independent, outside individual therapist to help you through. Of course, I am in full support of that, being a therapist myself. Okay, so when we're talking about radical acceptance, one of the things that often can come up is the way that we are talking to ourselves or talking about the situation. And oftentimes the way that we are talking about it are fueled with judgments. So judgment words like good, bad, right, wrong, ugly, gross, disgusting, hideous. These are all words that I have heard people use in talking about their scarring alopecia, which absolutely breaks my heart. I had the privilege recently of getting to jump in a little bit as a patient advocate volunteer, and I had the opportunity to talk to several people who had either recently been diagnosed or had just recently found CARF at the time, now SAF, and had reached out for some support, which is also a great resource. But oftentimes those initial conversations, the judgments that people poured on top of themselves and poured on top of their appearance particularly, or how this impacted their self-worth, was really just heartbreaking. So we want to catch judgments and we want to notice them come up. We're not asking you to never judge again. We're just asking that you pay attention and try to reframe using just the facts. I have hair loss. I have diffuse hair loss. When I went recently to the hairdresser, she noticed that the thinnest area is at the crown of my head. So this is not, oh my gosh, this is so disgusting. What's going on in my head? I can't let anybody see this hideous spot, right? This is just sticking to the facts. So we're not saying that you're not still going to have those feelings. However, we don't want to pour gasoline on an already burning fire. I guess sort of pun intended for those of you who have burning symptoms of scarring alopecia. We want our emotion can get big enough without the judgment. So we really want to prevent ourselves from pouring more gasoline on top of that. Okay, so radical acceptance is the gateway to self-compassion. We have to practice both. And when I say practice, I really mean practice. So it's not a one-time event. Radical acceptance is not a one-time event, and you don't become self-compassionate overnight or by doing it once. You have to practice over and over and over again and catch yourself when you notice getting out of acceptance or out of self-compassion. So acceptance of life's pain, we have to practice that acceptance that life is painful. And then we need to be intentionally kind to ourselves because life is painful. And that's true for everyone. Okay. So I like to call this the reverse golden rule. I don't know if that's really a thing or not. I have no idea if I made it up or someone else did, but this is sort of what I came up with. We're always teaching our children to treat others how you would want to be treated. So self-compassion is treating yourself how you want to treat others. Treat yourself how you want others to treat you. And think about if a friend called you and said, I was just diagnosed with scarring alopecia and I found out that my hair is falling out and I don't know if it's going to grow back. I doubt the first thing that you would say to them is, oof, man, you're going to look ugly. You're going to be hideous. Whoa, man, what are you going to do? This is terrible. You should probably go hide under a rock. You would never say that to someone else. You would be kind and compassionate and loving and understanding. And so we often extend that to other people, but have a really hard time extending that back to ourselves. And it really does take an immense amount of practice. Okay, so let's learn. Oh, actually, before we learn how to practice, there's one other thing that we want to chat about. Okay, so when we get diagnosed with scarring alopecia, there is our senses get threatened. And we're not necessarily threatened by the alopecia. We're actually more so threatened by the self-loathing statements, by those judgments that we put on being diagnosed with scarring alopecia. We are threatened by the harshness that we use with ourselves. And so when we get threatened, we play the defensive line. Okay, so those defenses are fight, flight, and freeze. I'm sure you've heard of all of that, right? So self-criticism is when you are both the attacker and the attacked, okay? You are the attacker and the attacked. So remember that anytime you notice yourself using a judgment or a harsh self-criticism, that you are attacking yourself, okay? That flight response, flee from others and isolate. I've heard so many people say, I don't go out anymore. I'm hiding away. It's too windy of a day. It's too sunny of a day. It's too rainy of a day, whatever the case may be. All of these worries that kicked up. And it's not that those worries are not valid. Of course they are valid. And we always want to practice self-validation of whatever we're feeling, because this is a very distressing disease to have. That's valid. If you are listening right now, it is valid to feel that way. And at the same time, we have to figure out how we can practice that self-compassion, practice that self-validation and radical acceptance in order to keep living life so that we don't go into flight where we are no longer doing the things that kept us engaged and loving who we are and the life that we're living. The other thing that can happen is freeze. This is when we are ruminating about the pain, and as you can imagine, this increases suffering. If I am constantly checking the back of my head to see if that spot has gotten any bigger, if I'm asking my husband to look, if I am making extra doctor's appointments and I'm thinking about it and researching, and I notice that I'm spending more than half or 75% of my time doing that, you are in freeze mode. And this is really going to get us stuck and really increase suffering. This is essentially living in non-acceptance. Okay, so we need to deactivate this threat and activate our safety and care system in order to improve our self-compassion. And so the way that we are going to deactivate that threat is by practicing self-compassion. It's sort of the antidote for this threat. Okay, so the first thing we need to do, so here we go. We're going to get into some more concrete steps about how to increase our self-compassion. We have to find a compassionate voice. This is step one, okay? I grew up in New York. I'm originally from Brooklyn, lived most of my life upstate New York. And I will tell you, New Yorkers can be kind of harsh. They are, and I don't mean that as an overall generalization, maybe just my New York family. But they can be pretty harsh, pretty rough at times. And so perhaps you don't want to find your inner New York voice when you are practicing this. But we really want to find the voice of that person who loves us unconditionally, who spoke to us softly, who uses kind words, right? And we really want to imagine what kinds of words do they use, and also what is their tone. I doubt that they are talking to you through gritted teeth with a grimace on their face and being really harsh, right? We want to also practice catching judgments judgments and criticism of both ourselves and others. Okay, so we're not just practicing the self-judgments, we're also practicing catching judgment of others, because the more we practice catching any judgments at all, the better we get at replacing them with facts and being overall less judgmental, which again is like removing that can of gasoline that you're pouring all over. One really helpful way to do this is to actually write a letter to yourself from your compassionate voice. And you're going to want to practice this both on paper and then out loud. You really want to hear what it sounds like when you are speaking kindly to ourselves. I know there could be some of you right now eye rolling. I'm not saying a lot, but if that is you, I understand how difficult or silly this may sound. Silly is a judgment, right? So we want to stick to the facts. And the fact is that if you are here listening to this presentation right now, there's a really good chance that you may have some difficulty finding your compassionate voice. And so we need to practice, and we need to practice in a lot of detail. So I can't just show up to the Super Bowl and expect to play football and win, right? I've got to practice all season long, and before that even in the off season and when I was in high school, right? We have to keep practicing in order to get really good, so that when we get to that big game, that we are more prepared to be able to use the skills needed. Okay, so I wish I could take credit for this. I cannot. I don't think that I mentioned earlier that I'm a dialectical behavioral therapist, which was created by Marshall Linehan back in the 80s. It's a skills-based program, and there was a Dr. Juliet Nelson who made an addendum skill to the curriculum called Sacred, and it's specifically for practicing self-compassion. This is essentially the way that she wrote it. I did alter just a tiny bit here and there just to make it more appropriate for scarring alopecia patients, and also added an E as well. So we'll get to that in a few minutes. Okay, so if you have available something to write with, pen and paper, whatever you may have handy, I'm going to ask you to do some of this as we walk through it. We won't be able to do all of it. However, I do want you guys to start actively practicing and getting some ideas of how to move forward. Okay, so this is an acronym. It starts with an S, and the S stands for softness with self. So just like we just talked about, finding that compassionate voice. Once you find that compassionate voice, we want to keep going. And we want to find that gentle tone to our inner voice. We want to notice when we are self-criticizing and be able to step back and say something encouraging. We want to pretend that we are, in fact, soothing someone else. who's scared and overwhelmed, because let's face it, this is scary and overwhelming to hear that you are losing your hair. What would you say to someone who is scared and overwhelmed? What would you say to a young child who comes to you and is afraid that there is a monster in their closet and they can't fall asleep? You wouldn't scream at them and tell them you're being ridiculous, go back to bed. You would say, oh, come here. You would hug them. You would caress them softly. You would give them a pat on the back or rub their back and help calm them down. We want to do this for ourselves. We want to even caress ourselves in a soft way. We can, one of those little self hugs, right? We can do this in lots of different ways. One of my most favorite ways to use touch with compassion is actually to tickle the inside of my arm. I don't know if you guys can see that. I'm not sure which way to go. There we go. It's actually just to tickle the inside of my arm. It's very soft and light. It creates a nice, loving sensation that actually feels quite relaxing. But you need to find what works for you. If that is cupping your hands in your face and rubbing your cheeks, or giving yourself that tender, soft hug, give to yourself exactly what you would give a friend who was in that type of overwhelmed state. Okay. The next thing is the A, is attribute. Okay, so actually let me pause there for just 1 second. I want everyone to go ahead and write down 2 words that you have heard yourself say that you use when you're being hard on yourself. So just 2 words. I tend to use it's hard to admit out loud, but I will. I sometimes hear my little inner voice say like, oh, you're such an idiot. Why did you do that? Or like, ooh, like bad hair day. Like what is going on up there? Like don't look in the mirror. Okay. So those are usually some ways that I'm hard on myself. So the next thing I want you to write down is 2 antidotes for that, 2 kind things that you can say to yourself in place of those hard criticisms. So for instance, I may say to myself, it makes sense to forget things when you've got a lot on your plate. Or I may say, the curls on the left side of my hair are feeling a little wiry today, right? Or I don't enjoy the way that my clip is sitting at the top of my forehead. So sticking just to some facts. Okay, I hope you guys were able to write something down. All right, let's move on now to the A. So attributes. This is a really, really important one. These are 5 things that you can reliably recognize about yourself no matter what kind of day you are having. They need to be things that you know are true in your wise mind and that never waver no matter what is going on in your life. Even when things are at the worst and falling apart, these need to be things that you stick to no matter what. So it can be physical attributes, it can be character traits, accomplishments, anything that you can look to and reliably reflects yourself in a positive frame, okay? And then you're going to write them down and you're going to keep them handy. So right now on your list, I want you to come up at least with 1 thing, just 1 thing. And I would love for you to continue after the webinar is over and come up with 4 more. And then my suggestion is to put them in the notes section on your phone because most people have their phone pretty much at all times or at least nearby. And this is a really great way to keep them handy. We want to study them and we want to use them when we are struggling with negative self-assessment. Okay, hope everyone was able to write down at least 1 positive thing. So I'm going to say that the 1 thing that I will share with you all tonight, my 1 positive trait is my sense of humor. I feel like that's been pretty steady throughout all my years of life, and it's something I can rely on as something that I can appreciate about myself. Okay, so the next letter is the C, and this is about creating a kind environment. So when I was doing some of the patient outreach volunteer coordination, many people that I talked to endorsed that they had very few people in their life that they had even shared their diagnosis with, and some of them for fear that the people would not be kind or compassionate to them. These are not the people. If you anticipate this person is going to be super harsh with me, like some of my great family in New York, those may not be the people that you share your diagnosis with. However, we can find some people that are already in our life or start seeking out people who are kind and gentle. We want to have reminders of the people who support us, saving a nice, kind voicemail that someone has left you. And if you're really struggling with this, leave yourself a voicemail. That's okay. We need somewhere to start. If your support group is very small or non-existent at this point, make that a priority. Because we need tribes in order to go through life. I had a good friend who said that she thought she was independent, so independent until she needed her next door neighbor to open up her mayonnaise jar. And I thought, like, no, like that's what being independent is. It's knowing that you needed help opening the mayonnaise jar and knowing exactly where to go and who to go to help you open that jar, right? We need people in our life to help us open the mayonnaise jar. And so if you're feeling like that basket of people is small, I really, really encourage you to go through the ScarringAlopecia Foundation, or try to look in some other places, find a hobby that you may be interested in, and try to start growing your support group. Okie doke. So let's move on to the R. I just want to be mindful of the time here. Okay, so we are going to move on to the R, which is radical self-acceptance. So we talked about radical acceptance a little bit earlier on. And just a reminder that acceptance is not approval or agreement. It's just acknowledgement of what reality is. If there is a brick wall in front of you that you cannot run through, it's simply saying, hey, that brick wall is here. I cannot walk through it. It's not saying you love the brick wall. You're so glad the brick wall is here. Eventually, one day, maybe you will find out that you really are glad that the brick wall is there. But for right now, all we're asking you to practice is acknowledgement of what is. So when we are using radical self-acceptance, we are accepting that we are human, that we have both failings and accomplishments. We are both flawed and gifted. We are also going to notice that we can much easier accept the flaws of someone else, and sometimes can't let the flaws of ourselves, we can't embrace the flaws of ourselves with that same kindness. We are going to accept ourselves wholeheartedly without fear that it will make us worse. So when I say wholeheartedly, I mean with mind, body, and soul. And when you notice yourself getting out of that acceptance, you work towards moving back into that acceptance. Notice the words that you're using with yourself that may be communicating to yourself that you're out of self-acceptance. Okay, the E, encourage. So this is the one that I added. I think that actually the original version may had the D including also the E. So I just added an additional one because I do think it's really helpful. And this is just to encourage yourself. You need to be your own cheerleader. Nobody else is going to know exactly what you need to hear in any given moment better than yourself, right? And so practice some self-validation statements as well. In fact, write some down that communicate to yourself that your emotions make sense, that your experience, given the circumstances, makes sense. Create a breathing mantra. This actually is one of my most favorite things to do. And you can breathe it in and breathe it out. So for instance, you might breathe in, I am, and breathe out, more than my hair. You're going to find whatever works for you and have that be your go-to statement, especially when you notice that anxiety get kicked up, when you notice more hair in the shower drain, when you are finding that urge to check your scalp to see how much more is lost, and that anxiety gets kicked up, or that worry or that embarrassment, and practice in and out that breathing mantra. So I love for everyone to take that same piece of paper and writing utensil and write down a very short mantra for yourself, whatever it is that you think that you need to hear right now. You are welcome to steal one of the ones that are up there on the screen, and you are welcome to write your own. As I mentioned, you know what you need to hear better than anybody else. Okay, what I don't want you to write down is anything like, suck it up, this isn't a big deal, right? These are all self-criticisms, invalidating self-statements. Okay, I hope everyone was able to write something down. Let's move on to the last letter, which is D, and this is deeply like yourself. When you're noticing your self-criticism getting turned up, turn your mind on purpose to your commitment to like yourself. You're going to notice any thoughts, any feelings that are interfering with this commitment. Sometimes we just get willful, guys. We get like, oh, like I just can't today, or I don't want to, or, and guess what? That's okay. If you're practicing self-compassion, right? You can say like, today it's really hard, right? Like, oh man, this is not about throwing yourself a huge pity party and staying there for the next week. However, it is allowing yourself the grace to just notice, man, some days this is really, really hard to be compassionate with myself, or validating to myself, or to turn my commitment to genuinely and truly deeply liking myself. And at the same time, I can do it. I need to practice. And actually practicing when it's hard is really important. Sometimes clients will say to me, you know, oh, well, I can use the skills when my emotion's at like a 5 out of 10, but when I get to a 10 out of 10, like I can't use any skills. And I get that, right? Like when we're completely emotionally overwhelmed, it is much harder for us to be skillful. However, that's the exact time that we need to be skillful. So make sure that even on those hard days that you are able to continue to at least try to practice. Okay, so just a couple of quick resources for you guys. That first link up there is a 5-minute guided meditation to practice self-compassion. It's wonderful. If you guys get an opportunity to do that, that's a really awesome one to do. And you don't need really more than 5 minutes to do a guided meditation. There are some other ones that are quite long. And certainly if you have the time to do that and you find guided meditation useful, I would definitely check that out. You can actually even just put into YouTube self-compassion guided meditation, and a whole bunch of things will come up. But the particular one that's linked here is relatively short, and I did find to be very useful. And then there's 2 other sites here if you'd like to learn some more on self-compassion. There is Dr. Kristen Neff. Her website is that bottom one there, selfcompassion.org. She has a ton of information on there, some of it which I used to help me in the presentation. And so much more that there was no way that I could fit it on in a 30-minute chat. So that's all I have for you guys tonight. I hope that you guys are ready to start your journey of practicing being a bit more self-compassionate with yourself, and that you were able to write a few things down. So without further ado, I'm going to introduce my colleague, Kim Holly, one last time. She's a licensed marriage and family therapist in private practice, also down here in South Carolina. And she is going to be doing a presentation on mindfulness-based stress reduction, which I am so excited about. So Kim, please take it away.
Hello. Thank you, Andrea. Okay, so I too am a DBT therapist. I do not put myself out there as an expert in mindfulness-based stress reduction, and we do a ton of mindfulness when we are teaching our clients. Mindfulness has been around for a while in the United States now, and one of the people who started the official mindfulness-based stress reduction program, John Kabat-Zinn, I think of as one of the people who brought mindfulness to be more mainstream in the United States. So it can be a helpful way to manage stress. It can be a helpful way to cope. Mindfulness-based stress reduction is actually a program that has been kind of standardized. You can find programs throughout the world now. It was originally created at the Stress Reduction Clinic. It's now called the Center for Mindfulness at the University of Massachusetts Medical Center. John Kabat-Zinn started that. He also worked closely with Saki Santarelli. They did a first draft starting in 1979. It was designed to be a public health initiative to support greater health, well-being, and I love this part, wisdom, so you can be more wise. They basically were asked at the University of Massachusetts Medical Center to help people manage stress when the medical center had run out of medical treatments. So it started with a lot of cardiac patients. There were people coming in with panic attacks, and there's a mind-body link. So the premise was that stress reduction could be applicable to any health issue. They turned it into a book in 1990 called Full Catastrophe Living, and that phrase, the title, came from a movie. So let's talk about what it is. We will come back to a little bit more history because I found this pretty interesting. But what it exactly is it was standardized into an 8-week program that basically met weekly for 2.5 hours each week, and about maybe after the 5th week, they do a 1-day, all-day mindfulness retreat. I had it on my bucket list. I had heard about this and read the book way back in 2005 when I first started teaching mindfulness. And I had it on my bucket list to do eventually because it involves committing to 45 minutes of practicing mindfulness meditation each day. What this looks like is body scans where you very slowly work basically paying attention to different parts of your body. So you might listen to the guided meditation, and it might say, start with your right foot and pay attention to what you feel in your big toe. And then it would guide you through going through each of your toes, down through the ball of your foot, along the top of your foot, through your arch, and it very slowly and methodically goes through your right leg, then your left leg, works up through your core, works up through your hands and arms, and you become much more aware and much more connected to your body over the course of an 8-week period. There are also 45 minutes of mindfulness where you might just, they call it following your breath, where you're literally just paying attention to your in-breath and your out-breath. I'm going to guide you through a brief one of those tonight. And every time you are practicing self-compassion, you're practicing dropping judgments, you're basically bringing yourself back to your breath over and over and over again, because the mind is like an untrained puppy. We take off into a different corner, and just like we would with a puppy, we want to start being gentle. We want to say, come on back, puppy, come over here, stay out of the trash, or don't chew up that power cord. Right? We wouldn't be harsh with the puppy because the puppy does this. And so we're training our brain to start having new habits. There are also some guided meditations that are used throughout this 8-week program. Each week they give you new things to practice. For example, they do a mountain meditation where you imagine yourself as a mountain and grounded like a mountain. They do some gentle yoga with the understanding that there might be a lot of people who have chronic pain and have some medical conditions that lead to pain. So they're not doing one-armed handstands and things like that. It's not competitive yoga. It is, again, learning to tune into your body, learning to direct your attention, having a vote over where your thoughts take you. They also do a walking meditation where you would very slowly, very, very slowly, notice the weight shift, notice your foot contacting the ground from your heel through your foot, and very, very slowly paying attention to what it takes to actually move through the world while you're walking. They have exercises where you do mindful eating. And in fact, I'd like to walk you through one of those right now. Hopefully you got the memo that said to bring some kind of food. I recommend chocolate personally. That's a really nice way to start an introduction for mindful eating. If you have some dried fruit or some regular fruit, I'd like you to start where you notice first, look at your food item and see what you see on it. Some chocolate may have some decorative shapes, maybe embossed into it, or if you've broken a piece up of a larger chocolate bar, you may see how there's a different color in the portion that it's broken. You may notice that there's little bits of chocolate. Oftentimes there will be little bits that fall off. Now, after you finish looking at it, you can see how the light reflects off of it. If you're working with food, a fruit, or dried fruit, you may want to notice, is it opaque? Is it translucent where you can see some light through it? And then I'd like you we'll use different senses. Maybe you bring it to your nose and you smell. See if you can notice maybe a bitterness of the chocolate if it's dark. Maybe there's some fruit in your chocolate. Or I love chili chocolate. Sometimes you can smell that. With the fruit, you may or may not be able to smell it. If it's dried, it may not have a strong flavor. You may squeeze it a little bit and notice a little bit of a scent. And now I want you to slowly take a small bite of whatever the food is that you brought along. And I don't want you to chew it yet. I just want you to feel it in your mouth. Feel it laying on your tongue. Maybe you push it up against the roof of your mouth and you notice the texture. If it's chocolate, you may notice that it starts to melt a little bit. I want you to keep whatever the food item is right along the front part of your tongue now. And notice, if it's a dried fruit or a fruit, you may want to do just one bite into it to get a burst of flavor. With the chocolate, you may just hold it on the tip of your tongue and notice how that tastes on the tip of your tongue. Now move the item over to the left side of your tongue and notice if you can see that there might be a difference in how that food tastes on that part of your tongue. Okay. And you may do another bite. And we're doing this very slowly and just noticing what we can notice. This is mindfulness. Place the food item on the center of your tongue now. And try to see if you notice anything different along with that flavor. Sometimes as we move food around on our tongue, we get a different burst and a different taste from that food item. Maybe bite the object again. Notice how you can feel that texture through your mouth, and maybe place the food item over onto the right side of your tongue. And notice what you notice there along the flavors or textures of that item. With the chocolate, you may find that it's melting more, and you may be getting more bursts of flavor. Now experiment a little bit and see about if you put that object further toward the back of your mouth, further in the back of your tongue. At what point does it start to lose a little flavor? Because there are fewer taste buds as we go further back. Now I'll welcome you to just slowly and mindfully noticing each sensation and each pressure. Chew the object and very slowly chew it, maybe more than you would normally. And just notice how that flavor bursts through your mouth in different ways. And as that object gets very well chewed, I want you to deliberately choose when you swallow. And notice those sensations as you allow that food to slip out of your mouth and down your throat. Okay? And you may find that you got a lot more out of that food than what you normally would. I know I did this with a raisin in the class, and I remember thinking, ooh, I don't like raisins. They're not generally something I eat. But I was very surprised that I actually enjoyed the raisin when I did mindfully eat a raisin. It had a lot of flavor that I had not paid attention to. I had categorized raisins as unenjoyable for decades, and actually only bought 3 or 4. I literally wouldn't pick it up on the scanner. I went to a bulk area of the grocery store and just got literally 3 or 4 raisins. And it was interesting to enjoy those raisins on that night that we did mindful eating. The last thing I'll say about this slide, about what mindfulness-based stress reduction is it is not multitasking. We talked a lot about how when we think we're multitasking, we're actually slipping back and forth. We're changing our attention. And you may have noticed this even while you were eating mindfully, that there were other things you were thinking about. You may have even noticed judgments. Okay, if we go back to the history a little bit, when John Kabat-Zinn and Saki Santarelli were working with mindfulness-based stress reduction and creating this program, at one point they ended up on the Bill Moyers special called Healing in the Mind, and it was very much looking at this mind-body connection. They were in in episode 3 of this 5-part series. I do give you a link at the end to look at that if you would like to. It's very interesting because they show people just laying on the floor, doing a body scan, and being coached through when maybe they had some difficulties. And there was a huge burst of interest in mindfulness-based stress reduction after they were featured on Bill Moyers' special. And that series has now been viewed by over 40 million Americans, and after 30 years. So mindfulness has been integrated into hospital settings, medical clinics, schools, different businesses have implemented it, prisons. There were some research studies even in prisons, professional sports. There are sometimes people will, like even divers will mentally prepare and imagine themselves doing their dive. That is a mindfulness activity. And there's many, many other areas that mindfulness has been implemented. At this point, the Mindfulness-Based Stress Reduction Program, which is this standard 8-week program, is in over 720 medical centers and clinics throughout the world. And there are some online options, which I actually give you I have a link to one that's free. I will say that doing it online alone can be very challenging because it's hard to commit to 45 minutes of sitting still and paying attention to your body or paying attention to your breath or imagining yourself as a mountain. And it's hard to commit to that and stick with it when you do it alone. But there are some low-cost options or even the free one where it's self-guided. Here's a quote from Viktor Frankl that I was introduced to during the mindfulness-based stress reduction. It's between a stimulus and a response, meaning some event, there is a space. And in that space is our power to choose our response. In our response lies our growth and freedom. This is Viktor Frankl. He was a neurologist and a psychologist, and he was at Auschwitz at one point in his life. And he treated it as almost an experiment. He was surprised to have survived it. And he wrote Man's Search for Meaning later. And this idea of noticing an event, And we can do this together even. If you think about an event, I remember when my daughter was small, and my husband and I were going to go for a hike with this baby. And my husband, once he decided he wanted to do something, he would get antsy and say, let's get going, let's get going. And I used to get really irritated with him. And when I realized that this was his own anxiety, because I remember I used to get snippy and say, like, the baby can't eat a power bar. I'm getting the food together, or I'm getting ready. We are getting going. And once I realized that event, him saying, let's get going, it created anxiety for me. And when I could recognize that this wasn't him being irritable, it was his own anxiety showing up, I could react differently. And it's interesting now because I will notice that he will start pressing when we need to go somewhere. Maybe we're planning to leave at 10 o'clock, and by 9:45 he starts his, let's get going, let's get going. And I can see that he's creating anxiety for my daughter, who's now 18. And I can see her going through this experience of getting irritable back, and trying to encourage her to say, like, just let him be. That's him getting anxious, and we don't need to turn it. That's that stimulus, him saying, let's get going. And that allowing that space is the mindfulness. That moment when I can choose to not react, to not let his anxiety create anxiety for me. And it's a freedom where now I can soothe him. I can say, we're working on it, right? Instead of having this back and forth where we're all getting testy with each other. And it is a freedom. And that's what, over and over again, when I took this mindfulness-based stress reduction course last summer, I would hear people who had not worked in mindfulness say, wow, I see myself slowing down. I catch myself, and I'm responding instead of reacting, and I like myself better as a result. That is the power of mindfulness. Okay, so research outcomes. After 30 plus years of the mindfulness-based stress reduction existing, I found over 851 articles on PubMed, one of these online research article databases. 850 alone. Okay, when they look at meta-analyses where they try to lump a lot of this data together, and they look at systematic reviews, 79% of these articles are showing positive effects. For example, one of the first research done with the mindfulness-based stress reduction is they looked at psoriasis, and they looked at some healing light treatments. And they took one group and just had them do the light treatments, and they took another group and they guided them through some meditations that lasted sometimes as briefly as just 30 seconds, or they would last up to 10 minutes during the light treatment. And they found that the people that had the guided meditations healed up to 4 times faster. So talk about a powerful mind-body connection with some mindfulness. They also looked at people who received flu vaccine, and they found that when they introduced mindfulness-based stress reduction, people had a better immune system response with the flu vaccine than without the mindfulness-based stress reduction. They found that there was decreased hostility in prison inmates. And this one was one of the big ones, this one about cardiac rehab patients. This was definitely at the University of Massachusetts Medical Center. They had people that had heart attacks, had in periods of angina or AFib, and they took these people who they'd done everything medically that they could for them, and when they went into mindfulness-based stress reduction, they found that there was a 41% decrease in mortality relative to people who did the medical treatments alone without mindfulness-based stress reduction. So meaning that these people were at risk for future heart events, and 41% less had those heart events that were lethal compared to the people who did not do mindfulness-based stress reduction. That's powerful. In 2013, there was a group that looked at mindfulness-based stress reduction for treating anxiety and depression. And they also found that for chronic pain. So for those of you who do have chronic pain, you may find that if you were to do a mindfulness-based stress reduction class, or even started to do some mindfulness exercises on your own, there are lots and lots of books. There's tons of articles out there. I provide a link at the end of this presentation to one article that I really found useful. And also, for example, in the book Full Catastrophe Living, they look at a woman who had some nerve pain in her hands. And they looked at her, she basically indicated on there's a picture in the book of basically a cutout of a body. And she showed where she had pain, and she had pain in her hips, and she had pain in her arms, she had pain in her hands, and she had pain in a lot of different places in her body before the mindfulness-based stress reduction. And 8 weeks later, when they looked at where she had pain, she still had pain in her hands, but that was the only place she had it. So a lot of times it's that when we experience pain, and pain is a very interesting thing because our reaction to pain oftentimes causes more pain. Similar to what Andrea said about the suffering that comes from not accepting pain, our brain adds to pain a lot of times. And who wouldn't want less pain instead of more pain? Okay. So I have one slide here, one of the adaptations to mindfulness-based stress reduction. For any of you who may experience depression, I think that this is worthwhile to just know about, because there's actually an adaptation to mindfulness-based stress reduction called mindfulness-based cognitive therapy for depression. And in fact, the University of Massachusetts Medical Center not only offers the MBSR program, they also offer mindfulness-based cognitive therapy for depression. So you could sign up for that separately. And it was created by these authors that I list here. And it was shown that it reduced relapse for those with recurrent depression by 50%. So it's the mindfulness-based stress reduction and this adaptation using mindfulness can actually be very, very powerful. It was powerful enough that it actually allowed some people to taper off medication completely, which is pretty amazing because a lot of times for depression, they say to stay on medications and treat it almost like a chemotherapy for cancer, because when depression recurs, it can be very life-altering. So, okay, and there's actually a book. I list the book here. Okay, here's my last slide. I listed out the John Kabat-Zinn Full Catastrophe Living book. If you are interested in this, it can guide you through the 8-week program. Mindful.org talks about the science of mindfulness. For those of you like me who like to geek out, that's great. There's a link for the Bill Moyer special. It is still online. There's also the link for the free self-guided MBSR program online. So if you wanted to dabble with this a little bit, see what it's about. Some people have the self-discipline to do that on their own. I found I needed to, I did better doing it with a group and enjoyed that. And bouncing ideas around. And then the last thing, I wasn't able to link to this, but if there is someone who I was hoping maybe Jean or somebody would be able to track down this article, there was actually an article out there that I found called Can Mindfulness-Based Interventions Improve the Quality of Life of Patients with Moderate or Severe Alopecia Areata? So I recognize that's not the same as scarring alopecia, and it may, if there are those of you who like to read research articles, maybe you'd be able to track that down. So, Andrea, back to you.
That was amazing. Oh my gosh. That was a great presentation. And also my wheels were just spinning about how, from what I know about scarring alopecia and being a patient myself, as well as the people I've talked to, how useful all of those strategies could be in enhancing the medical treatments. So, and I know, Kim, you and I have talked a bit about sort of for scarring alopecia, there's currently no cure. And from one person to the next, it sometimes feels like, no two snowflakes are alike. And so people are maybe trying similar things with varied results. And so being able to add some of these strategies, or, I'm hoping that some people will go and take the full 8-week course and really take the time to learn about mindfulness. I'm blown away by some of the stats on the impact it has on medical problems. Like the study about psoriasis, I know several alopecia patients use some laser light therapy to help reduce inflammation. I'm just thinking about, like, can we get a research study with mindfulness-based stress reduction? And like, I'm excited now. I want to keep learning some more. So, do you have any recommendations for people who are just starting out with mindfulness? So we did the mindfulness eating practice, which was wonderful. Do you have any other ideas for people who are just wanting to dip their toe in and see, is mindfulness for me? What are some other things they might be able to try?
I would recommend looking online and seeing what piques their interest, right? Like mindful eating, I think, is a good start. Following your breath. I remember kind of panicking the first time I was supposed to be following my breath in a DBT skills class I was sitting in on, and realizing that I was chest breathing a lot and starting to judge myself, like, how am I ever going to teach this? But now, after, gosh, I guess it's been 17 years that I've been doing this, my breath is my friend. It's like it's always here with me. I may not sit with it for 45 minutes all the time, but even if I'm sitting in the grocery store, just taking a moment to take one breath and notice where I might be feeling some tension when that person is, not, maybe has 20 items in the 8-item line or something, and I'm feeling irritated, of just being able to slow down and notice, like, oh, my shoulders are creeping up around my ears, and just being able to take a breath and use some other compassion of, it's just a rule in my head that I don't want to be a Karen. That's not fitting with my values. And so just being able to even use a breath here and there can be so empowering to allow us to center back into our bodies. But I would really recommend going online and looking. You can Google mindfulness and see what types of exercises come up, because I do think that just following your breath can be somewhat daunting. But there's a lot of ways to be mindful. You can be mindful of, feeling your hand, or, even just, there's all these nerve endings between your fingers that even just rubbing your hands together, you can be right here, right now with that, and nobody would even notice if you were doing that in a meeting, and it's a soothing, self-compassionate thing, and bringing you right here, right now.
Yeah, I love that. That's great. That's really great. The other thing I was thinking about too, as you were reading that Viktor Frankl quote, I was imagining, as some of our patients are, headed into their next doctor's appointment with their dermatologist or whoever they may be seeing for their alopecia, and already having worry thoughts about, what am I going to find out today? Right? Is it worse? Is it better? Am I in burnout? All of these sort of anticipating, like, the worst case scenario, and just having that knowledge that they have, that, like, okay, look for the space, right? I'm going to get some sort of news, whether it's good or bad, however I categorize that. We want to be mindful of those judgments, but however we're going to categorize that we have the ability to have that pause before we respond. And come from a mindful place. And if we can come from that mindful place, we can then get to self-compassion, right? Because we're going to be more mindful of how we're talking to ourselves, how to manage some of the anxiety. So I just loved that quote. That was great.
Yeah, even the idea of uncertainty, right? How often we we don't think of uncertainty as pain. It's definitely pain. Who wants to be on pins and needles? What's it going to be? And oftentimes we rush to fill that space with things that aren't true rather than be uncertain.
Yeah, yeah, absolutely, absolutely. Well, I know we do have a couple of questions, and so we're gonna get them up on the screen and then decide who it feels like would be best to manage that. And actually, since we also both know DBT, even though we had separate presentations, I imagine that we both are more than capable of answering most of these. Okay, so the first question is, I feel like I'm ruminating, like you mentioned. I'm constantly thinking or worrying about how much hair I'm losing. What tips can you share to tell myself? Yeah. So this is something that I have experienced firsthand. In fact, actually, the checking, lots and lots of checking behavior with scarring alopecia patients, either checking in the mirror, checking how many strands of hair have fallen out. And so some of it is even just noticing the checking, because this prompts the ruminating, right? When we're looking and worrying, right, then this gets our brain a little bit more stuck. So sometimes I still notice when I lose more hair in the shower than other times, especially after I know that my scalp has flared. I have a lot of burning and itching. And more so, like I had mentioned earlier, in the crown of my head has recently been the area that's decided to act up. And when I sort of have this anticipation of I know that it's coming, I'm more tempted to look at my hand in the shower. And some of it, again, is just about that stimulus and response, like Kim mentioned, of noticing, okay, that's the urge that I have, and I don't actually have to do, I don't have to do that. I don't have to check. I don't have to count how much hair there is. I don't have to look at it. Because at the end of the day, for myself, it doesn't help. Because then after I check in the shower, I get out and I check in the mirror. And now I'm asking my husband if he could check. And then I'm asking my hairdresser and my kids, like, who else can check this for me that I feel comfortable asking that of. And that actually makes it a whole lot worse. So some of it is actually being unmindful of the worries and more mindful in the moment. So rather than going with the urge to check how much hair has fallen out in my hand, I may say I have shampoo in my hand. I am massaging my head with the shampoo. I can feel my pinky finger on the front of my head. I can feel my thumb in the back of my head, and really walk myself through in a very specific way exactly what I'm doing and what's right in front of me. Like Kim kept mentioning, that right here, right now. So unmindful of the worry, avoiding that compulsion to check the hair loss, and then turning my thoughts towards something else that feels more soothing and compassionate. Kim, do you want to take a stab at that question also? Do you have any other suggestions?
Sure. I think it goes back to that acceptance too of, I think, having a vote. How do I want to spend my time, and how much of my airtime? Because sometimes, worrying, you may allow yourself, like, set a timer and say, okay, I get to worry for 5 minutes. And then after that, I'm going to deliberately go do something else. And maybe even have a list of things that are very absorbing to you, that you enjoy, right? Whether it's crafts, or I don't know if keeping your hands busy helps, whether it's gardening or playing with your kids or reading, and being able to mentally decide, like, am I willing to try to let this go? Because it will press on you. Anytime we're worrying, it continues to, raise its hand over and over again. And being able to decide, like, okay, how am I going to have this take up less airtime? Because I imagine the more you're ruminating, the more miserable it is.
Yes. That reminds me actually of the 3 C's, which is actually from Alcoholics Anonymous, but it goes along so well with radical acceptance of I can't control it, I didn't cause it, and I can't cure it, right? These are all statements of acceptance, like fighting against the reality of what's happening is in fact what causes the suffering. So I love that you pointed out that radical acceptance is another tool in getting out of that cycle of rumination. Yeah, absolutely. Let's see if we've got another question. Okay, I am so busy and don't know how to fit this practicing that Andrea talked about in my head during the day. Yes. Oh my gosh, yes. Yes, yes, yes. It is so, so, so hard to find the time to practice mindfulness and to practice that self-compassion. And so at the end of the day, though, when we think about time do we need to practice. I'm sure many of you are not familiar with the structure of dialectical behavioral therapy, but we run these skills classes, and at the end of every class there is homework where we want you to practice the skills that we're teaching before you come back the next week, and then we want you to share with us how did the practice go, what did you do. And I always tell people, like, I'm not asking for an hour. If you spend an hour, great. I'm asking for 5 minutes to intentionally set your mind to practicing this new thing. And if you can even find just 5 minutes, right before you go to bed, right when you wake up in the morning, while you're eating your lunch. Actually, that's my favorite time to do anything related to mindfulness or list making or checking my attributes and reviewing them. Because I almost always have my phone handy, and I usually, even if I don't have a full 30 minutes for lunch, I do have a solid 15. And so while I'm eating, I can just also review what those attributes are, or turn on a guided meditation, or even do some mindful eating. So it is hard, especially when you're trying to figure out where to create it in your day. And if you can pair it with something that you're already doing, like brushing your teeth, or putting makeup on, or your lunch, whatever thing you're already doing, see if you can try to add it on there so it doesn't feel like you're trying to create this whole new space for this new habit. Yeah. Mm-hmm. Kim, do you have any other thoughts? Oh, well, actually, Kim, did you have any other thoughts?
I'm a big fan of sticky notes. You know, I will put them on my dashboard because when I'm driving, I will run my brain is going to be thinking anyway. And so just being able to replace some of those, especially the ruminating, right? Who doesn't get caught when I could walk the dog and I'm thinking about something else. I'm not walking the dog. But being able to somehow remind yourself over and over again. And I even have a little mindfulness bell on my phone that goes bong randomly, and I see my team do this in team.
I have heard that bell, and actually I feel very peaceful now every time I hear it.
Because it's just this little reminder throughout the day that says, hey, you know, these aren't things that take any longer than the maybe self-criticisms we let run, or the ruminating thoughts. They don't take any longer. We're thinking anyway a lot of times. So how can we shift that mental state so that we're creating that little pause in that space?
Yeah, I love that you mentioned that we're already taking up time doing the ineffective things, right? We're just creating a new habit feels like it's going to be so much more work, right? Which is also why I love pairing it with something that you're already doing so that it doesn't feel like this new, sort of like when you first start going to the gym or took up a new hobby, right? Like it feels like, oh, I don't know if I have the time for all of that. But even if you just start out with 5 minutes, and then if you want to add on more time, then add on more time. Yeah. All right. Let's see about another question. Where can I find a good therapist that does MBSR, and how do I get into this? Kim, I'm going to throw that one over to you.
I don't know that you would necessarily need a therapist to do it. Oftentimes they're run as classes. You can look in your area. The one I did, because of the pandemic, it was online. And I don't know whether that seemed to work just fine because it feels like you are with the people anyway. I would imagine if they had them in person, it would be even more powerful. And so I would do a Google search for your area. I know that my dad and mom, when they were starting to go to a gym that was attached to a nursing home, they had to do a physical, and my dad was referred to a mindfulness-based stress reduction class, and they ended up doing it together at the University of Minnesota, where I'm from, and close to where they live. So they're everywhere, and even if you can't find one locally, you would be able to do. There's many offered online.
Yeah, that's awesome. And that actually reminds me as well that the Scarring Alopecia Foundation on their main page, I don't know if it's up yet, I haven't checked yet, but there is actually going to be a whole section dedicated to some mental health resources and some links for types of therapy that would potentially be a good fit for people with either chronic pain or scarring alopecia. Mindfulness-based stress reduction is definitely on there. And with each of the therapies, it does give some information about how to locate a program, whether or not it's a therapist that is trained in a specific type of treatment, or with mindfulness-based stress reduction. I think maybe we suggested actually a Google search within your area. So mindfulness-based stress reduction plus whatever area you're looking in, and quite a few things come up. So that's great. I think we might have a few more questions. Okay, do you have examples of ways to remind myself to reset my brain when I'm spiraling down? You look excited to answer that one, Kim. I'm going to throw that one over to you.
One thing that I keep thinking of as we're talking is we can use our bodies to communicate something different to our brain. And one of the things I've discovered over the years that I call it stewing. It's ruminating. But when I get stuck on something, I find that if I can do what we call a half smile, where you basically relax your face and put a tiny little bit of a smile on the corners of your mouth. So this is what it would look like. It's very subtle. There's not much to it. And it is a lot harder to ruminate if you do that. And you could call it a half smile. Again, I would be putting sticky notes up in places where you're likely to, if you get stuck, if you tend to spiral down when you're sitting there watching TV, if you're alone at night, or if you tend to spiral down at certain times of day, put a note up somewhere of things you can do that would shift you out of that. And whether it's a half smile or some of these encouragements or this list that hopefully you started when you went through the sacred skill with Andrea, because being able to practice and think of it as weightlifting, because it's not like you can do it once. Don't judge yourself or get harsh with yourself if it's not working, that you aren't able to shift out of it right away. It may be that you have to phone a friend, right? Hey, I'm spiraling, help me out. Or you're going to experiment. I often say you're just throwing spaghetti against the wall to figure out what might work.
Yes, awesome. I'll just add to that briefly with one of the things that I love is actually looking myself in the eyes in the mirror and saying, stop, this is not helpful. But the first piece of it is even just noticing that your brain did that shift of like, ooh, I'm not letting go, right? I'm still thinking about this thing. And I notice that using those mindfulness skills to notice that there's something going on the inside of your body and that your thoughts are trying to match whatever's happening. And then the other thing that I really love is change locations. And that can either be within your house, right? If you're spiraling in your bedroom, get out of your bedroom, go into the kitchen. If you're spiraling in the kitchen, take a walk outside your house if there is nice weather. Or sometimes just get in the car and go somewhere else. That actually happened to me today. I couldn't get my mind off of something, and I had an appointment, and after I left the appointment, I was supposed to come home, and I was like, nope, I'm going to go window shopping. I didn't need anything. I was sticking to my budget and not buying anything, but I knew it would be more helpful for me to continue to stay in a new location rather than get back in my car in that moment and start thinking again about that thing I was trying to not think about. So visually looking at yourself, saying stop, and then change of location. Okay, I think we might have one more question. Okay, just a comment. I'm reading Full Catastrophe Living and I'm finding it very enlightening and helpful. Yeah. I'll have to pick up a copy for myself. Yeah. Great presentations. Thank you. When I feel myself possibly reacting quickly to a situation, I silently tell myself, always choose kindness. That immediately relaxes me. Another is just to smile. Okay, I absolutely love that. Always choose kindness, especially when we're talking about self-compassion. This is even a reminder to yourself of choose kindness to me as well as other people. That's wonderful. That's really wonderful. Well, I think that wraps everything up. Kim, do you have any last comments that you wanted to add?
No, I don't think so. I think I really enjoyed this. I hope this is helpful, and I hope you all dive into mindfulness. It will change your life.
Yes, I remember actually when I first met you, you were telling me about how mindfulness reduced the amount of headache days you had. And that's always stood out in my mind as like, just sometimes those personal anecdotes about how things help someone stick with you even more than the research does. Although the research that you presented, whew. Well, this was really fun to do a presentation with you. I'm so glad that you joined me tonight. That was really great. And thank you guys for joining us tonight. I hope that you got some information that helps you step off into a new direction, whether it's creating some more mindfulness or practicing self-compassion. Be sure to check out the new SAF website with the new name, with their very calm and cooling colors that I love. You can join check out their website. The website is right there at the bottom, ScarringAlopecia.org, and it should hopefully be more searchable now as well. So we really appreciate you guys, and we hope you had a good evening, and we will see you next time. Thanks, everybody. Have a good night.
Bye, everyone.